The latest news about the coronavirus is moving in opposite directions. A second vaccine for the virus, developed by Moderna, has just won a key approval from the Food and Drug Administration, and this comes after the first distribution of the Pfizer vaccine at local hospitals. At the same time, coronavirus indicators in Boston for infections and hospitalizations are still getting worse. That's the main reason for the restrictions and precautions announced yesterday by Mayor Walsh. To bring us up to date is our guest from the Boston Public Health Commission, the interim executive director, Rita Nieves. Thank you very much for being with us again, Rita.
Thank you, Chris, for having me.
Rita, I want to start with one thing here is that this is a time of year when we look forward to getting together with people, and we're still fighting with depression normally. This is not a good time to have anybody tell us that we got to cut back on that. So how should people take this news?
I know, I recognizing that it's been months of us telling people, stay away from folks, keep to your family. And here we are again, having to repeat that all over again. But I think, what we want people to know is that maybe finding new ways and creative ways to interact with folks and being in community in different ways. The internet gives us, different options on how we can, stay connected with our family and friends, because, mixing households at this moment is risky. The minute you interact with somebody, that means you're interacting with that person and whoever that person has been interactive with. And the potential for getting infected with COVID, goes up. So it's unfortunate that we have to be giving that advice to folks, but we can see what happened over the Thanksgiving holiday and how we're feeling the impact of all those interactions that took place, among families and friends. Unfortunately, we have to keep this up and until our numbers, go back down and we feel more in control of what's going on.
I imagine a lot of people are going to be staying in town, but they're also going to feel a strong urge, almost an obligation, to be in person together with some of their closest relatives. How many people should they be limiting themselves to, and what kind of things should they do if they are going to be in pretty much the same space?
The most conservative recommendation we're sharing with folks is that you should celebrate the holidays with the people, people in your household, and not try to, feel that it's safe to invite other folks from your family, even if it keeps it to less than 10 folks, because again, anyone could be asymptomatic, for example, and come and, and be in a smaller group, but, have the opportunity to spread the virus. So stay with the people you live with, which are already the people that you're interactive with on a day-to-day basis, and now try to open up that network, because that's when we are seeing lots of, spread that way. And since we know that's one of the reasons, why our numbers are going up, we're asking people just to stay close to home and try not to invite anybody in your house, regardless of the size of the group.
And by the way, I've seen advice saying that if you do have people at your home, keep some distance, wear a mask unless you're actually in the middle of eating or drinking. So it sounds like if you are going to do this, you got to be really, really careful.
Absolutely. For folks that do, choose to do that, we're in New England, it's hard to be outdoors, but, we have said this around the Thanksgiving holiday. If you are having other folks that don't live with you, make sure that, you designate one person to be the one who's serving the food. Don't have everybody touching and being, around the food. Make sure you freshen up, bring some fresh air into the house. Make sure people are wearing their masks. When we're having dinner and sharing with folks, we tend to be loud. We tend to, tell jokes and all of that. So there's a lot of air droplets going out into the air while people are eating dinner at the dinner table. So that's a very risky, moment, if you're having a small gathering like that. And make sure that you ask people to wash their hands, constantly, and make sure you disinfect, all the surfaces that would, high touch surfaces. just to minimize, any transmission of the virus if one of the people, in your group, it's happens to be asymptomatic.
Yesterday, the mayor announced some new restrictions, essentially a rollback of the reopening, a partial rollback.
Mhm.
But what about the indicators that made him do that? What's going on?
So, there are like two sets of metrics that we have been monitoring, on an ongoing basis. So a set of the metrics gives us information as to how much is the virus spreading in the community. And then that includes, how many people are testing positive, what's the positivity rate, for example, how many people are taking the test in our communities. And then there's a set of metrics that gives us a better understanding on what is the impact on of the virus in our healthcare system. So, for example, how many emergency department visits we're seeing with people with COVID-like symptoms, how many ICU beds, are occupied, how many beds the hospitals are having to use for uh, non-surge beds that they're having to use. So that gives us a good idea of what's the burden on the system and how close, the hospitals are to becoming overwhelmed and having difficulties, caring for people. So when we put those two sets of metrics together, it gives us a pretty good picture of the risk and then our ability to care for people who are sick. So because our metrics have been going in the wrong direction for some time now, we had developed some thresholds that would give us a sense of, okay, when we get to this point, it's time to act and intervene and trying to put a break into what's going on and slow the spread of the virus. So those new restrictions are about that, having a temporary, intervening and putting some temporary restrictions in place so we can take control of the situation.
Well, what I see in those numbers is not necessarily a flat curve that's higher, but a curve that's still going higher. But I know there's some pushback to this from people, probably some of the business people. They might be saying restaurants aren't really accounting for much of this. So why pick on restaurants to be more restricted?
Actually, restaurants, when we do contact investigations, we're more and more hearing that in restaurants, precisely because those are the places where right now people can have up to six people on the table, right? In other parts of the state, you could have, outside Boston, you could have 10 people on the table. So imagine 10 people that don't live together, that are getting together for dinner without their mask on for at least an hour and a half, eating and drinking and having a good time, and laughing and all of that. So it's a high risk activity. And as we do contact tracing, we get to hear about where potential places where that person may have been infected. And the visiting restaurants, is one of those activities that is high risk. And sitting at a bar, it's also another high risk. So that's one of the reasons why we're limiting. We never went up from six people at a table to 10, but we're keeping it and enforcing it, and we're also restricting sitting at a bar to eat. Again, because it's high risk. It's a very high risk activity in the context of what's happening right now with such level of infection.
I want to ask you about testing. You have some new sites that are open this week, including one in Hyde Park that is a drive-through site. Why is the city doing this?
Well, because the more we test, obviously, the more we're able to identify folks who are, especially those who are asymptomatic, that are among us and don't know it. They feel okay, but then they're having the capacity to infect others. So the more we can test, the more we can find folks, both that are symptomatic or asymptomatic, and the more prevent those folks from transmitting the disease. So access to testing is key. It's a key strategy in us, fighting the virus. And the more we test, also the more our positivity rate it tends to go down, with that activity.
I know what is included here is free testing, but people also might need to make arrangements in advance. Is there anything you can say about how people can get details on that?
So we have in the city of Boston.gov, we have a link to a testing site where people can look at the different sites where they can go and the different processes for each one of them. In some cases, people can just walk in some other places you can register ahead of time. So it depends on people's preference. Some people just want to have an appointment and they know they show up and they'll be tested. Other people don't mind going to a place where they'll may have to wait if they're going to walk in.
And of course, there's also bphc.org with more
Yes.
information about COVID as well. We should thank you again very much for taking the time to be with us.
You're welcome. Happy to have to be with you.
Okay, good to see you again. That was Rita Nieves from the Boston Public Health Commission. We'll have more news in just a moment.